Hello, everyone. Thank you again for joining us for another episode of Real Talk on Rona. I'm your host, Janelle McGregor, with the City of Tampa, and I'm happy to be here with you all today. Thank you all again for joining us for this, again, second episode already of the Real Talk on Rona being brought to you by the City of Tampa, the Tampa Family Health Center, the Florida Department of Health, and Hillsborough County. I'm here today with my wonderful co-host, Melissa Garita, the Marketing Director for Tampa Family Health Centers. She is going to introduce our guest speaker today, Dr. Ashley McPhie, who will be giving us the real talk on how we can keep our kids safe during the coronavirus pandemic. Hi, Melissa. How are you today?
Good. Thank you, Janelle. Dr. Ashley McPhie was born in Ocean Springs, Mississippi, due to an early interest in caring for people. Dr. McPhie completed her undergraduate training at Xavier University of Louisiana and went on to attend medical school at the University of Mississippi to develop her career in becoming a physician. In 2011, she moved to Gainesville to complete her pediatric residency at the University of Florida. Dr. McPhie has always had a passion for community health, and in 2014, she relocated to Tampa and joined Tampa Family Health Centers as a pediatric provider to start addressing the growing healthcare needs in the Tampa community. She served the community in that capacity until 2018, when she was promoted to Director of Pediatrics. It is in this role she has been able to support TFHC's mission to provide quality, caring, and accessible health care to a culturally diverse community for the children and adolescents of Hillsborough County. It is a great pleasure to introduce Dr. Ashley McPhie. Dr. McPhie?
Hi, everyone. Good afternoon. Thank you, Melissa, for that wonderful introduction. I want to start by thanking Hillsborough County, the City of Tampa, and the Florida Department of Health for having me this afternoon. I also want to thank all of you in the community for allowing me a small amount of your time this afternoon. Today, for this presentation, I just want us as a community to engage in a conversation around children and babies and coronavirus. I want to start with just giving you guys a few of the facts, the needed information so that you can continue these conversations in your household and with your community leaders. So we're going to just start with what is coronavirus. Dr. Monica Ryder, our Chief Medical Officer, yesterday gave a presentation that really addressed those answers. I want to just revisit it a little bit. So coronavirus is a virus. There are several different types of coronaviruses. Most don't cause symptoms in humans, but there are a few that do. COVID-19, the coronavirus that's causing respiratory illness in our communities, is a new form of coronavirus that originated in Wuhan, China. At this time, we know it is spread when a person coughs or sneezes. Those particles and droplets are released into the air. They travel a short distance, fall to the ground, and they can remain on surfaces for a period of time. Hence the social distancing that we have currently in effect that asks you to stay 6 feet apart from other people. In your children, I'm sure you guys are asking, well, Dr. McPhie, what symptoms do I look for? Symptoms in children are much like they are in adults, but they can tend to be mild. So you're looking for that cough, fever, runny nose, maybe trouble breathing, shortness of breath. They may feel tired, not want to eat as much, have diarrhea or vomiting. Those can can look similar to other viruses, and you may be saying to yourself, well, Dr. McPhie, my kid always gets those symptoms, and they get those symptoms several times a year, and you're not wrong. Just consider the history. So is my child in daycare? Have we had any known exposures? So were we out with someone who may have had coronavirus or traveled to those cities that are considered our hot zones right now? So New York, New Jersey, Miami. Have I been in groups of 5 to 10 or more? And you want to use all of that information and deciding if you should be concerned about coronavirus in your child. It is also important, and it brings up a good point, to remember that some kids are asymptomatic. I'm sure that you've heard that on the news and media outlets and from sources on the internet. They can look and feel fine, have just a little bit of runny nose, and actually be carrying or spreading a virus. So that is why it is also important to continue those cleaning measures, continue washing hands, using hand sanitizer and things like that. It really brings me to my next point of how are we stopping the spread? What are we doing in our homes and communities to really slow it down? We're working on flattening this curve, and we've been doing an excellent job in Hillsborough County. There's a lot of talk right now about reopening, and I really like that talk to be around turning a dial, not exactly an on and off, but we are going to dial up, stepping back out and getting back into our lives again. And while we're doing that, how can we stop the spread of coronavirus, and how can we keep our babies and children and other loved ones safe while we're doing that? So I'm just going to give you a few tips and pointers, things that you can do at home and in your communities to try to keep everyone safe. And the first one is keeping it clean. So per the CDC, we want to have clean hands. Washing hands with soap for at least 20 minutes is ideal. If you do not have access to water and soap at the time, please use an alcohol-based hand sanitizer. You want to avoid people who are sick. So people who are coughing and sneezing, even if it's those family members, we want to make sure that we are taking measures, even in our home, while someone is sick. Separate bedroom. They have their own designated bathroom that they use. If you have the availability to do that, and not all of us do, but if you do, take the extra steps that you can. You really want to clean and disinfect what I call high-touch surfaces. So with kids, we know that'll be their toys, their tablets, their iPads, their cell phones, but also think about things like the backs of the chairs, the light switches, the doorknobs, things we're putting our hands on regularly, the knobs in the kitchen for the cabinets. So we're touching those things often. We want to clean and disinfect frequently. You want to wash and launder items that you've been outdoors with when we come outside, clothes off, wash everything in the warmest water you can. And this would also include stuffed animals. And any person in your home that is sick, again, you really want to kind of isolate them as much as you can and wash their clothes separately in warm water and things like that. And we really, really want you to play it safe. So I know it's tough right now, but play groups and getting kids together. Right now, under the advisement of the federal and local governments and your medical professionals, it's not a good time. Kids are, by nature, not good at social distancing. They want to be together, loved, playing, sharing their experiences. So you want to make sure that we're limiting time with other children, limit time with grandparents, older adults, and really focus on other activities. There are several other types of play that you can do with your children as far as projects and things for them. There are several things with technology that we can do to get them engaged with other children, and I'll speak to that a little bit more in just a couple of slides. So again, you're stuck at home, and that's tough. Trust me, I understand, but staying active is important. I can't express to you enough how much exercise helps with any illness, not just with coronavirus. Keeping the lungs inflated, keeping those lungs healthy, keeping your children healthy. So in addition to those indoor activities, plan for some outdoor open space activities. I understand that we don't have access to the normal outdoor spaces that we do, but there's still so much at your disposal. Take a bike ride, go on a group walk together, maybe point out, new things that you find on nature, explore the area in which you live. This is a rare opportunity for us to get outside, see our community, and really make those bonds and connect with our family. The exercise will be great for parents as well. So it really puts everyone in a healthier state and a healthier mind frame. It's important also for children to stay connected socially. In this day and age, we really communicate a lot through technology. Kids are out of school. They are missing their friends. They're missing their grandparents, their other family members. Reach out to those people. Speak to them. Set up video chats or Zoom calls. Do things like family dinners. I've done that with my friends and my family, and it really helps bring you back together and feel connected and really feel that we are all in this together. It takes away some of that loneliness. The kids would love to be able to have these conversations with their friends, check on them, see how they're doing. We can get back into some long forgotten or dead practices of writing cards and letters, sending those things out through the mail. People love to receive those correspondences because we don't do those things anymore. And then work on art projects, decorations for the home, get creative, puzzles, coloring books, things like that. Engage their minds. We really, really want to help them stay connected, make these things, send them to grandparents, and it really does bring a smile to your child's face, and I think it's really healthy and beneficial for parents as well. And I wanted to speak to this point because it's very important. Children feel stressed too. So they may not always express it the way that adults do. Sometimes this may be outbursts or temper tantrums, loss of appetite, eating too much, sadness. They may even have difficulty with sleeping. You may notice some attention and concentration issues above and beyond what normally happens while you're schooling your child at home. I would really take time to talk to your child about the coronavirus, what's going on in the community, why we need to stay home, why we're out of school. Those things are very, very important, and it allows them to mentally wrap their head around it, understand why we're doing the things we do, understand the rules, and kind of get out of a funk that they may fall into, and a lot of us may fall into. So having those conversations and keeping it open and honest really, really does go a long way. And I really want to end with saying thank you to the people of Tampa for staying home. Thank you for working the essential services. Thank you for promoting social distancing and knowing that we are all in here together. I do want to take a second and talk to you guys just a little bit about well child and vaccines and getting those things completed for your children during this pandemic. I talked a little bit about the safety of your child. Vaccines are a part of that. They're very, very important. Right now, the CDC and the American Academy of Pediatrics recommends that pediatricians focus on the newborn care visits and getting those well child and vaccines completed for children 24 months of age and younger. Here at Tampa Family, we are doing that as well. We are trying to keep you safe, keep you well by having our well visits in the morning, our urgent care visits in the afternoon. We have a designated well center for our children to go to. And a lot of pediatric offices in the community are following those exact same guidelines. So I really encourage you to reach out to your primary care office. Keep those appointments. Those appointments are more important than ever. We are dealing with one pandemic now. We don't want to end up dealing with another one on top of what we're already doing. So if there's anything that you take away from me and this conversation we're having today, it's that well childs are important. Vaccines are more important than ever, and maintaining social distancing and cleanliness, hand washing, and the use of sanitizer are more important than ever. So with that, I'll leave you with one big thank you. And I'd like to continue this conversation by answering a few questions that you guys submit to me.
Thank you so much, Dr. McPhie, for that very, very enlightening presentation. We do have a couple questions that came in. The first one is, if one of my children is showing symptoms, should I test both children?
Thank you, Janelle. That is a very, very good question. So with all the news and coverage around the coronavirus pandemic, it's easy to think that a possible diagnosis of coronavirus is an emergency in your child. But I want to remind you of something that I just said. Children often display mild symptoms that resemble a cold. So I would recommend that you reach out to your primary pediatrician. If they offer telehealth, use it. Based on children's symptoms, they can help you decide and have that conversation whether you should test or continue to stay at home and provide supportive care.
Thank you. Another question that came in is, a baby, one of our parents will have a baby who's going to be 2 months old at the end of April. And they would like to know if they should keep their appointment with their pediatrician.
So the first thing I'm going to say to that is absolutely. I'm very, very passionate about children staying on schedule, getting their recommended vaccines, making sure at those critical ages where their development is just starting and kicking in that you see your pediatrician. So I can't express enough how important it is during this time to keep your child's immune system strong. Like I said, as per guidelines, we are prioritizing newborn care and well care with vaccines for children through 24 months of age. Also keep in mind that many pediatric offices, including Tampa Family Health Centers, because we are here for you, we have made changes to promote wellness. Like I said, we have well visits in the morning. We have urgent visits in the afternoon. We have an established well center where we're doing nothing but well child checks and vaccines. And we are also promoting our telehealth services. So please, please, please contact your pediatrician, reach out, ask about those services, and whatever you do, keep those appointments.
Thank you. Some parents will be returning back to their offices soon. What recommendations would you give those parents who will need to rely on daycare?
That is a very, very good question, and I thank you for asking. It is also a very complicated question. So like I said, toddlers, they do not understand social distancing. They want to love, they want to touch, they want to be interactive. There are many child care centers that have remained open during the pandemic, and the CDC has many recommendations to help promote wellness and safety, such as masks for children 2 years of age or older, and staggering pickup and drop-off times. So I encourage you to call your child care center and ask about those interventions, see what they're doing, and then use that to make an informed decision whether to send your child back or not.
Thank you. Another question just came in from a parent who is asking, should their children wear masks?
So the CDC recommends that if a child is 2 years or older and is able to wear a mask, they should wear a mask. Now, trying to get a child who's 2 to wear a mask is very, very difficult. So that is the current recommendation, but again, it is something that is hard to do.
And lastly, we just received a question from a viewer who is asking for recommendations on disinfecting playground equipment.
So with that, I would say just keep it clean. You have your hand sanitizers, you have your wipes. So if your kids are going to be getting on a swing and you're out there and you're at the parks, which are not currently open, but when they do, wipe down those surfaces just like you would wipe down any high-touch surfaces.
Thank you so much again, Dr. McPhie, for taking the time to educate us on coronavirus and, making sure that us parents and caregivers have some information that we can fall back on so that we could keep our little ones safe. We want to definitely thank everyone for joining us again today. Please take this time to understand what coronavirus is and that there are different types of coronavirus out there. We're asking everyone to please also make sure that you join us next time when we have our next episode of Real Talk on Rona. And one thing, Dr. McPhie, that you said that definitely stuck out in at least my mind today is the importance of us educating, especially our teenagers who may be wondering, why they're learning virtually and why we're telling them to stay in the house. That's definitely vital information. So thank you again for sharing that information with us today. The Rona is real, folks. If you or someone you know have any of the symptoms, we are definitely asking that you please go and get tested. Currently, the county has 2 testing sites, one at Raymond James Stadium and the other at Lee Davis Community Resource Center. It is free. You don't need insurance. You just need to call and set an appointment. So please, we can't stress that enough, how much if you're experiencing symptoms, or even if you know someone down the street, your neighbor, a family member, who may be, letting you know they don't feel too well, encourage them to call, make an appointment so that they can seek help. The coronavirus, again, we can't stress it enough. It is a deadly virus. So when you start feeling sick, get on out there, call, schedule an appointment so that we can test you and make sure that you will be okay. The good news is we will get through this together. Thank you so much for joining us today. Again, make sure you tune in on Monday, April 27th at 12 p.m. to learn how we can identify different symptoms within individuals who have chronic conditions. So all you asthmatics out there like me, this is definitely an episode that we will not want to miss. Thank you again, Dr. McPhie and the Tampa Family Health Center staff along with our partners at the Florida Department of Health and Hillsborough County government for helping to make Real Talk on Rona possible. Stay calm, stay safe, stay informed, and we'll see you next time. Have a great day.